Many people feel nervous or even scared when they hear the words birth control pills. There are a lot of myths about them. Some believe they cause weight gain, harm fertility, or are unsafe for long-term use. These fears can feel especially overwhelming for people with polycystic ovary syndrome. PCOS is a common hormonal condition that affects about 1 in 10 women of reproductive age. But here's the truth. Birth control pills, specifically combined estrogen-progestin pills, are actually first-line treatment for PCOS. Doctors recommend them because they directly target some of the main problems caused by PCOS. So what are these problems and how does birth control help in PCOS? PCOS often causes irregular periods and high androgen levels, which can lead to acne and excess hair growth. When you use birth control pills, they help the situation by lowering hormones called gonadotropins. And this lowers your ovaries' production of androgens, or male hormones. The estrogen in the pills also boosts sex hormone binding globulin. This protein binds to free androgens in the blood and lowers their activity in the body. So using birth control pills in PCOS usually means that your periods become more predictable and symptoms like acne and hirsutism start to improve. Birth control pills also protect the lining of the uterus called the endometrium by triggering regular bleeding. This protection matters because people with PCOS who don't ovulate regularly are at a higher risk for endometrial overgrowth or endometrial cancer. One common question patients have about birth control is, how early can you start birth control pills for PCOS? Combined oral contraceptives or birth control pills are considered safe and appropriate for use in both adolescents and adults of reproductive age, including those with PCOS, as long as doctors first review each person's individual health risks and contraindications. There is no universal minimum age for starting birth control pills. Instead, doctors base the decision on the reason for treatment, such as contraception or managing PCOS symptoms, the patient's maturity level, and their overall health profile. For adolescents, combined oral contraceptives may be started if there is a clear diagnosis of PCOS or a strong risk of developing it. This is done through shared decision-making between the patient, their guardians, and their healthcare provider, and includes a careful check of cardiovascular, metabolic, and blood clotting risks. What are the risks of birth control you should know about? Like any other medication, birth control pills can have side effects, but for most people with PCOS, the benefits outweigh the risks. Doctors consider things like weight, blood pressure, blood sugar, and risk of blood clots, and often use lower dose estrogen pills to reduce side effects. It is also important to know what birth control doesn't do. While it helps with hormone balance and period regulation, there is no strong evidence that it improves weight, BMI, or overall quality of life on its own. More PCOS-specific research is still needed in those areas. Fear around birth control pills often comes from misinformation. In reality, they are safe, well-studied, and considered the first-line therapy for PCOS when pregnancy is not the goal. By managing hormones, regulating periods, and protecting the uterus, they help prevent serious long-term complications while improving quality of life. If you have PCOS and feel unsure about birth control pills, talk openly with your doctor. Together, you can make a plan that fits your health, your goals, and your peace of mind. If you have questions about PCOS, leave them in the comments and I'll try to answer them in a future video. And don't forget to click like and subscribe below, and I'll see you in the next video.